Hello everyone and welcome to Climate Australia, and a special episode of this because we're actually hosting an event today for Better Futures Australia. We've got a panel happening called Better Healthier Futures. This is bringing together people from different parts of the healthcare sector who also care deeply about the health impacts of climate change. So first, I just want to acknowledge the traditional owners of the land on which I am broadcasting to you from today. Hi, I'm here on the land of the Turrbal and Yugara people, and I'm also on Gubbi Gubbi land. I'm on some contested land here in the peninsula, Redcliffe Peninsula. I'd like to acknowledge the traditional owners, past and present, and I'd also like to acknowledge any First Nations people who are joining us today here and acknowledge the ongoing relationship that First Nations people across what we now call Australia and the world have with land, sea and sky. And of course health, given that that's today's theme. So I'd like you all, if you're in the chat, you can tell me about yourself, where you are, what country you're on, and also remember that throughout this you'll be able to ask questions of the panel in the chat. So you might be joining us at the home of Climate Australia, which is CimpaticoTV. Hi, and hello to those of us joining us on Facebook Live and YouTube Live as well. Wherever you are, you can get those questions in and comments as we go. And remember to let us know about introduce yourself and the country that you are joining us from. So the intent of the BFA Discovery series that this panel is a part of is to work to expand on existing climate works and bring in new actors through the sharing of inspirational stories, the possibilities for better futures, and building momentum towards a national moment, the Better Futures Forum in July next year, 2021. So this is just one part of a bigger picture. So today we've got three guests, so I will introduce them each one by one, and then they'll have an opportunity to speak to us about their part in this big picture. And then we'll have a bit more of an open forum Q&A where you can all write in questions for anyone or everyone on the panel as we go. So first I will introduce the first guest, Fiona Armstrong. I'll tell you a little bit about her before I bring her on screen. So Fiona is the Executive Director and founder of Climate and Health Alliance in Australia. So CAHA is the acronym. This is the first national coalition of health groups formed in 2010 to tackle the health impacts of climate change. She's the architect of the world's first framework for a national strategy on climate health and wellbeing for Australia in 2017, a lead author of the Queensland Health and Wellbeing Climate Change Adaptation Plan 2018, and an author of many of CAHA's reports. So without further ado, I will welcome to the stage Fiona Armstrong. Fiona, welcome. Thank you so much for coming today.
Thanks so much, Lee. Thanks for helping to be part of this event.
Oh, my pleasure. So without further ado, I will pass over to you because you've got a bit to tell us, I understand, about the healthy, regenerative, and just policy agenda. So I'll pass over to you.
Awesome. Thanks so much, Lee. Well, such a pleasure to have the opportunity to bring this agenda to you and to share some of the work that we've been doing. Before I begin, I'd like to also say on behalf of the Climate and Health Alliance that we recognise Aboriginal and Torres Strait Islander people as the traditional custodians of the land on which we live and work, and acknowledge that sovereignty of the land that we call Australia has never been ceded. And at Climate and Health Alliance, we're committing to listening to and learning from Aboriginal and Torres Strait Islander people and organisations about how we can better reflect Indigenous ways of being and knowing in our work. So I'll share my slide in a minute just to show you the cover, the beautiful cover of the Healthy, Regenerative and Just Policy Agenda. But just to begin by telling you a little bit about how this is positioned in relation to the Better Futures Australia initiative. So the Climate and Health Alliance is, as Lee suggested, a world first alliance. There are now a number around the world of health alliances working together for climate action. We've been leading on policy development, advocacy, research, translation, and communications in the space of climate change and health since 2010. And in an effort to bring the voices of the health sector and the perspectives and expertise of the health and medical community to this issue, have produced lots of reports, as well as our ideas about what we need in terms of policy frameworks to tackle the health impacts of climate change. So one of those that Lee mentioned is the framework for the National Strategy on Climate, Health and Wellbeing for Australia, which we developed in 2017, following a really extensive consultation with the health sector about what they wanted to see in a national public policy response. Working with other allies around the world in the global space, at the global climate talks, we'd had a tiny bit of progress in that we got health recognised in the Paris Agreement. So signatories to the Paris Agreement are obliged to consider the health of their citizens in the context of their national climate change response. So how, we asked ourselves, would the Australian government respond to that without a national strategy on climate, health and wellbeing for Australia? So we entered into lots of conversations and a very deep consultation about what that would look like, and developed the framework in 2017. I'm pleased to say that over the ensuing years that call has become increasingly mainstream, is now supported by organisations like the Australian Medical Association, the Royal Australasian College of Physicians, and in the Lancet Countdown, which is a global annual report on how nations are doing on climate change and health. It's now become a global call. In that one of the recommendations in the Lancet Countdown 2020, which was just released this week, a key recommendation is for all nations to develop a national strategy on climate, health and wellbeing. So we're pleased and proud to have developed the first framework for that, and offer that to anyone who wishes to pick it up and use it to guide their own national strategy on climate, health and wellbeing. So as part of Better Futures Australia, we've been involved in, I'm just looking for my screen that I can share with you. I'm not seeing it when I go to share screen, so I'll just paint a picture with words perhaps. Oh, there we are, healthy, regenerative and just. So when COVID happened, we recognised that the disruption that COVID caused was an opportunity to have a big conversation about the kinds of future that we want to see in Australia. We recognised that, like everybody else who is calling, to build back better, that we need to use this moment to make sure that we pivot towards a low carbon and on our way to a net zero carbon future. We also know that because of the biodiversity crisis, that we have to make sure that we tackle that at the same time. So our future must be regenerative. It must be, create a circular economy, and it must ensure that we don't use resources, our natural resources on which our health depends, more than at a faster rate than they can be replaced. And recognising that global inequity with every passing year is increasing, and COVID has laid that bare, with people who are more vulnerable, more likely to contract COVID, to suffer from it, and to be disproportionately impacted by climate change. So we're saying that our new future must be healthy, regenerative and just. And we built that agenda based on, again, consultation. So we spent several months talking with over 100 thought leaders in Australia in a series of events that we've called the Rewrite the Future roundtables. We brought people together to talk together about what possible alternative futures for Australia look like. So we've developed a range of different possible scenarios based on whether we, invest in change, whether there's no change, whether there's marginal change or maladaptive change, or whether there's radical transformative change. And we developed this healthy, regenerative and just policy agenda based on the preferred future that we designed through those conversations. And with this policy agenda, we're mapping out a pathway to get there. We're building on the framework for the national strategy that we developed back in 2017. So, in effect, this is a kind of update to that agenda. And we added an eighth area of policy action, thriving ecosystems, in recognition that, we must protect nature in order for nature to protect us, and that our health depends on a healthy natural environment. So the healthy, regenerative and just policy agenda is built on 8 areas of policy action. One is health promoting and emissions reducing policy, so mitigation in any other terms. It also requires us investing in emergency and disaster preparedness, as we've seen with the bushfires in the last summer, and indeed with COVID-19. COVID as a pandemic is a predicted and foreseeable event, and in fact was predicted by many infectious disease experts. So we must be prepared for these kinds of events. So that's another area of policy action. Leadership and governance, we know, is incredibly important. So we've recommended the types of governance structures that we have to have in order to be able to implement effective climate and health integrated policy, because these are policies that both help us tackle climate change, but protect and promote health at the same time. We need to have healthy and resilient communities. So that's another area of policy action, as is a sustainable and climate resilient healthcare sector. We all rely on the healthcare sector in times of crisis, and when we're at our most vulnerable. So it's absolutely critical that that's an area of policy action that we're investing in as part of preparing, responding to, adapting to climate change, and indeed mitigating, because the healthcare sector in Australia is responsible for around 7% of our national emissions. So that's a massive impact, and it's one in which we need to take responsibility for as a sector. So we have outlined in Healthy, Regenerative and Just our vision for the future and these 8 areas of policy action. They also include education and capacity building, and that's about educating the wider community. It's important that the wider community understand the links between climate change and health, and we know from some excellent research by Sustainability Victoria that they don't always make that connection. So we need to help people join those dots. We also need to invest in building capacity in our health professions so that they understand the risk that climate change poses. Research and data is also obviously critical to underpin the decisions that we make and to monitor the progress that we make when we invest in climate change strategies. So along with thriving ecosystems as our 8 areas of policy action, we've now mapped out that pathway, and we hope that this will be a useful underpinning as we go through these conversations to develop better futures for Australia.
That sounds like a really positive future for me and a much healthier one. Thank you so much, Fiona. I really appreciate all your comments there, and there's so much for us to talk about more. So to everyone on the chat, you will have opportunity to ask Fiona more questions about everything she's just outlined there. Thank you so much. And now I'll be moving on to our next guest. But before I do, I'll just give a shout out to some of the people who've been commenting on the Better Futures Australia Facebook page. We have Kimberly, who is saying, Kimberly Humphrey here, EM physician from Cornerland. I hope I said that right, Cornerland in South Australia, and also Deputy Chair of Doctors for the Environment. Hello, Kimberly. We also have Jenny from Narragansett Country, Cooma, New South Wales, from Climate Action Monero. Great to have you. We have Sue. Sue's here from Yaggaran Turrbal Land too. Great to have you. And we have Mike coming to you from Ramaytush and Alone Land. So he is actually in California, in the States. So we've got some international people watching on as well. Hello to you all. We've now got another guest, Dr. Kate Wiley, who will be joining us. I'll tell you a little bit about Dr. Kate Wiley before we bring her up on screen. So Dr. Wiley is a GP, a climate activist as well, and is based in Adelaide. Dr. Wiley founded Climate Medicine, an advocacy project where she presents to community groups on the health effects of climate change. She's an accredited education activity representative with the RACGP and works with Doctors for the Environment in educating medical professionals on climate and health. She's a member of the Climate Reality Leadership Corps, having completed training with Al Gore. And in all her work, Dr. Wiley applies a medical model to the climate crisis and as such offers a treatment plan for climate change. She seeks to activate her audience so they can become more involved in creating the paradigm shift that we need to combat the climate crisis. So today, Dr. Kate Wiley will speak to us about Doctors for the Environment Australia's work in educating the medical profession about health and climate change, which obviously is a huge job. So welcome to the stream, Kate. Great to have you here.
Thank you, Lee. Thanks so much for the opportunity to come along today. I really do appreciate it.
Well, looking forward to hearing what you have to say, and I'll pass it over to you.
All right, thank you. Okay, so first I'd just like to acknowledge that I'm on Kaurna land. The Kaurna people are the traditional custodians of the Adelaide Plains. So Namani, which is greetings to a group of people in Kaurna. As Lee said, my name is Kate Wiley. I'm a GP. I'm really passionate about climate change and health because, after all, climate change is a health issue. The effects that we're seeing from climate change are health effects, and we need to look at it from a health perspective in order to enact change. I have a personal advocacy project called Climate Medicine where I present to community groups about climate and health, and I've got a website to back this up. But today I'm here representing Doctors for the Environment Australia. So DEA are a group of doctors and medical students from across the country who volunteer their time to get action on climate change and health. We're a very active group. We engage with politicians. We give public presentations. We engage with media, write journal articles, etc., and basically do all we can to get action on climate and health. My main focus is on education, and today I'm in particular focusing on the education of doctors and especially GPs. Doctors and health professionals are going to be at the coalface in treating the health effects of climate change, and so obviously we need to understand it from that perspective to be good at our jobs. But also, if the health sector fully understood that climate change is a health issue, then we could use this narrative when we're talking to our patients, talking to the wider community, and help shift the narrative around climate change in this country. You know, we've done this before. We did it with smoking, we did it with alcohol, we've done it with obesity. We do that thing where we shift the narrative. You know, like we used to smoke on planes. Smoking used to be a normal thing to do. Now smoking is a really unsociable thing to do, and we need to make carbon unsociable in the same way we made smoking. I think doctors are the ideal group to do this, and the reason why is because we're in every community across the country. We're in urban communities, rural communities, rich and poor communities, Anglo, culturally and linguistically diverse communities, you name it, we're there. And, you know, GPs in particular are embedded in our communities. We have the ear of the populace. More than 90% of Australians see a GP once a year. So, you know, we have this reach that, you know, political parties would dream of. So if all doctors were educated about climate change and health, then we could use this knowledge to talk to our patients about it. We can communicate about it. We can talk about the health risks. We can, you know, talk about the bad news. You know, doctors, we break bad news, and, you know, there is a lot of bad news around climate change. But what's really important is that we can then offer a treatment pathway. We can offer a management plan so that we can do something positive about this. You know, I think it's really important to be solution focused. And, you know, I welcome what Fiona outlined in her presentation before, because, you know, there's a lot of disillusionment around climate change, and that's because, of course, it's a massive problem and it's absolutely terrifying when you look it dead in the eye. But we need to be able to show that there are things that we can do, that we can make positive change, and that the future isn't written. And, I think if doctors are modelling these changes, so, with our active transport, cycling to work, going solar, using renewable energy, divesting, etc., we send a powerful message to our community, and we create that paradigm shift that we need in our culture, from one that destroys nature to one that is a nature restoring one, and create the social expectation for political action. We've been knocking on the door of politicians now for 30 plus years. James Hansen was a NASA rocket scientist, and he presented to the US Congress in 1988. And he basically said that burning fossil fuels was causing global warming. That's more than 30 years ago, and we're still having this sort of political stuttering response. I think if we can change the social discourse around climate change, then that has knock-on effects to how people vote, and then that's when we get the political action. So this concept I took to DEA earlier this year, and of course they were very supportive about it, and supported me in becoming an education activity representative of the RACGP. And a couple of months ago, we started rolling out our education program. We've had a few education sort of introductory sessions, providing overview sessions on climate change and health, sessions on pollution, and we have a evidence-based medicine journal club where we look at evidence around climate and health, so that when we're talking to media and talking to our communities, we're informed and following evidence-based medicine, following the science. I hope it's okay for me to give like a quick little plug about a couple of things I've got coming up. Next Wednesday, the 9th of December, Dr. Sarah Mollard is hosting a group session on through nature to nurture. So it's a webinar on the mental health impacts of climate change, which of course is a very important topic. The following Tuesday, the 15th, we've got Chris Barden doing one on maternal and women's health in a changing climate. Tickets for these can be found on Humanitics, or on the DEA Facebook page, or on My CPD, which is the RACGP portal for any GPs watching. And obviously next year we're going to be expanding this education series further, looking at fortnightly webinars and online learning modules. So that's kind of my shtick. Fundamentally, I think climate change is a health issue. It's vital that health professionals are educated about climate change and health, and then once health professionals, we can inform the wider community. This helps change the narrative and shift the paradigm so that we get true climate action in this country. All right, that's me. Thank you, Lee.
Thank you so much, Kate. And of course, to everyone watching, you'll have more opportunities to ask Kate more questions too. Hello also to Ivory, who is saying hello from Queensland Conservation Council, volunteering there for MS Queensland. And hello to Remy watching from Dara Glands. Hello to you both, and anyone else who's been just joining us. Whether you're watching on the Better Futures Australia Facebook page, on Climate Australia within CimpaticoTV, or on YouTube, hello. And stick around, you'll be able to use that chat not only to introduce yourself, although keep doing that, but also to ask some more questions. Jenny says, great to hear Kate talk about nature restoring action. That really is at the heart of it all. Agree with you, Jenny. And right now we're going to pass on to another guest here today. This is our third guest, and then we'll be going to our kind of Q&A section where you'll be able to ask more questions. Our next guest is Dr. Simon Judkins. So he is an experienced deputy director with a demonstrated history of working in hospital and healthcare industry. So he's in emergency medicine, critical care nursing, healthcare management, healthcare and clinical research. Dr. Simon Judkins today will speak about the work being led by the emergency medicine community and the Australasian College of Emergency Medicine on the climate emergency. And the word emergency does come up a lot when we're talking about climate crisis. So I'll welcome to the stream Dr. Simon Judkins. Welcome.
Hi, how are you going? Thanks for having me. It's always a bit intimidating or nerve-wracking being the third speaker when the first two speakers were so good. But I'll give this a crack. And
I'm sure you'll do great.
immediate past president of the Australasian College for Emergency Medicine, and as I said, the deputy director of the ED down at the Austin until recently, and I'm actually working up in Echuca at the moment, so up in the Campaspe Shire, the lands of the Dja Dja Wurrung, the Toowoomba and the Yorta Yorta people. Most importantly, as I said, I'm an emergency medicine physician, but most importantly, I'm also the father of 3 teenage boys who are growing up and worried about their future, a future that has to be healthy and that has to be sustainable. And not only as a healthcare professional trying to advocate for the health of our communities and our populations, I'm also a father trying to advocate for, the future of my children and all of our kids, all of my nieces and nephews. So it's incredibly important that they see that, we're not standing by just watching this happen. We have to be active in advocating for climate change and really trying to hold our politicians, particularly at this time, into account for their lack of action. So I'm going to talk a little bit about what colleges do, and particularly what the Australasian College for Emergency Medicine has done over the last decade. But it's not only the Australasian College for Emergency Medicine, it's other colleges, it's the anaesthetists, our GP college, clearly, College of Psychiatry, the AMA, lots of medical colleges are stepping up into climate change advocacy. And it's an interesting change because colleges are traditionally about education, training and standards. So it's about training emergency clinicians to be specialists, but clearly the advocacy for public health measures and particularly the advocacy for climate change and the health impacts has become a very strong part of what we do. It's really been the last decade that we've really stepped up in this space. So I was the conference convener for our national conference in Melbourne in 2014, and we declared that was going to be a green sustainable conference. Our foundation lecture, which was the first year that had been introduced, was on the health impacts of climate change. So we had Professor David Carraway, who delivered on climate change and why that is important for emergency medicine, and Professor David Butler about the evolving planetary health emergency, and that was open to the public, and we had a very large attendance at that foundation meeting, and it really sort of kicked off our ongoing advocacy. And since then, the college has been very, very vocal in this space. All of our conferences now have sessions on climate change and health, which are getting stronger and stronger, and more people attending. The last conference where we could attend, this year's conference was a virtual conference, but in Hobart of last year was a pivotal moment for our college when our new president, Dr. John Bonning, 2 days into the job, declared a climate health emergency. And we had a march of 200 emergency clinicians from the town hall down to the conference centre. And at the conference centre, we were joined and applauded by members of the Extinction Rebellion. So that got a lot of media coverage. And since then, we've continued that strong advocacy. The conference was entitled A Changing Climate of Emergency Medicine, and clearly had a very strong focus on climate change. We had Bob Brown delivering that climate lecture on climate change and advocacy, giving us some sort of tips and tricks on how to advocate and really get in the ear of our politicians. Professor Helen Berry on climate change and the impacts of mental health. And we actually had some speakers from the South Pacific and neighbours who talk about the impact that climate change is having on their countries and their health systems. So incredibly strong messages there. The conference was, again, it was a all vegetarian conference. All the food was sourced locally. There was waste reduction strategies, recycle or reuse. So it was probably the most climate change conference that we've had, and so building up and up and up. The most recent conference, which was a virtual conference, we had a panel discussion about applying the lessons from COVID-19 and tackling the climate crisis, with multiple presenters discussing the impacts of climate change and our advocacy. But it's not all about our conferences. Our Public Health Committee is very focused on climate change and health, and it's probably our #1 ticket item when it comes to our advocacy around public health. Kimberly Humphrey, who's been on the chat, she's on our Public Health Committee, and she's recently been elected as a board member of the Doctors for the Environment. We're working with other colleges to collaborate on raising the health impacts of climate change, with multiple webinars and presentations and papers going to various journals. And we've joined with the Climate Alliance on a number of public lectures. I was involved in a public lecture earlier this year with Fiona and Brett Sutton, myself, and talking about the impact of the bushfires. In 2022, our college is hosting the International Federation for Emergency Medicine Conference in Melbourne, Better Care for a Better World, with a strong focus on our role in supporting our neighbours in the South Pacific and low-income economies who will be impacted by rising seas, heat storms, changes in infection parameters and patterns, and how our increasing carbon is having a direct impact on population health and the survival of these countries. Through other partnerships, for example, with Choosing Wisely, we're really trying to focus on our carbon footprint. As Fiona mentioned, our health industry produces a large amount of waste and a significant contributor to atmospheric carbon and has a significant carbon footprint. Collaborating with organisations such as Choosing Wisely really focuses on waste reduction and trying to decrease inappropriate and unnecessary tests and investigations, and making that link clearly between what we do in the clinical sphere and how it impacts our waste. As a college, and many colleges have done this, we've divested from coal and carbon industries. The college has had an ethical investment strategy in place for a number of years now. We're in the process of rewriting our environmental plan, which is going to look at what individuals can do, not only in their own working environment as an individual, but also messages and lessons they can bring to their own departments, and strongly advocating with their hospitals to really try and put pressure on the hospitals to become more engaged in, as I said, reducing waste, reducing our carbon footprint, and doing things like installing solar panels and accessing renewable energy. And most recently, our college, our public health committee, made a submission to support the bill introducing the Act into Parliament by Zali Steggall, and outlined some support for the bill, and again pointing out the widespread impacts of a warming environment on the health impacts of individuals, our communities and population health. We also made a submission to the Royal Commission on natural disaster arrangements, on the National Natural Disaster Arrangements and Health Issues paper, calling for the links between climate change and national disasters to be clearly stated. So the college is doing a lot. A lot of our members are out speaking in media, radios, writing papers, etc. But there's a lot more to do. I think we need to be active. As I said, we can't sit by and watch the impacts of and just watch the impacts of the climate change on health. You know, heat waves kill more people than more and more people, and we're seeing record temperatures across the country, and knowingly standing by and understanding that is actually having a direct impact on people's lives. And we see it in emergency departments when those heat waves come through, that vulnerable patients, elderly patients, patients with chronic conditions end up in emergency departments, and certainly there's a strong link, a very well-known link between heat waves and increasing morbidity and mortality. There's obviously clearly the health impacts of drought. There's food insecurity and the disease vector changes, and clearly there's a strong link between climate change and the inaction from our governments on climate change and mental health of all populations. So the advocacy on climate change, the impacts of health, is firmly in the lane of clinicians, firmly in the lane of our colleges. And as the AMA said in a statement this morning, doctors actually have an obligation to step up and advocate for the health impacts and reducing and mitigating the impacts of climate change. And certainly I couldn't agree more. So that's all from me. Thank you for the opportunity to speak today.
Thanks so much, Simon, but your speaking is not over, because now we're moving from this, surprise face. We're going to have a little opportunity for everyone who's watching live to ask, not just you, but everyone on the panel. So I'm going to invite everyone back on screen now to join me, and Fiona's back on screen. So now we're all here together. We've got already some questions coming through as well, and if you're watching YouTube, Facebook, CimpaticoTV, you can write your questions in the chat there. So Lisa's asking here in the CimpaticoTV chat, she's asking, the health sector is really stepping up to lead on climate. How can we influence other sectors with the great example being set? And I'll go to Fiona first, since you've had the biggest break from talking.
Yeah, thanks, Lisa, for the question. It is a good one. Look, I think it's simple but complicated, really. But really, it involves collaboration, and that's been the modus operandi of the Climate and Health Alliance over many years. You know, we are an alliance, and bringing organisations together to develop a common agenda for advocacy, and bringing multiple perspectives from many different fields has been really critical to developing a, you know, coherent narrative and advocacy agenda. So I think there is no other way to solve this issue than to work together and to bring as many people together as we can. You know, it's a complex problem. We didn't create this problem, you know, individually. We can't solve it individually either. So we have to bring lots of different people together. And I think, you know, the power of our advocacy is that, you know, we've had perspectives from psychologists, from climate scientists, from, you know, human geographers, from emergency physicians, from, you know, clinicians who are working with people in community. And that means that the kind of agenda that we bring forward reflects that, you know, those multiple perspectives. So I think for other sectors, and that's where the Better Futures Australia initiative is so exciting, because for too long, the kind of job of acting on climate change is seen to be the responsibility of the environment groups, you know, where, as we've heard from Clayton Simon, this is far from being an environmental issue. It touches every sector of society, every profession, every person. We need everybody on board. And it's really helpful if the sectors that do have, you know, common infrastructure and objectives are working together in a way that's aligned. So I think that Better Futures, in the way it's bringing forward and showcasing all of the incredible action that's happening across every sector, and saying to, you know, the rest of Australian society, look, you know, this is not a sort of niche issue. It's very mainstream, and there are many ways for everybody to get on board. I think that's important. So I guess, put simply, collaboration is key.
Yeah, absolutely. Yeah. Kate, did you have something to add there?
I just wanted to carry on from that. You know, everybody needs to be involved, absolutely. And I think one of the ways to make people want to be involved is for them to appreciate that it affects them. You know, so that and that's where I think the health message is really powerful, when you say, you know, this affects your health, this affects your children's health, your grandchildren's health, your husband, your wife, your partner, whoever it is. And then we see that it becomes a personalised issue, and that makes you just more wanting, you know, it's empowering. It makes you want to do something about it, rather than just sitting back on the sidelines and seeing it as somebody else's problem. You know, we all need to be involved. None of us get to sit it out, do we?
Yeah, and I have to say, we've got a little backstage chat here on our side of things. So I just want to throw to a little comment that Fiona wrote while Simon was on, because you said in our little chat here, well done, Simon. I love all your personal stories and stories from the college as the context of your advocacy. Powerful. Yeah, Simon, did you have anything to add to that before we go to our next question?
Look, I think this is a personal thing as well, but it's personal for everybody. As you said, I mean, you know, previously it's been marginalised as being it's a green issue, it's an environmental issue, it's about, but it's not. This is about everybody's health, and it's about the sustainability. It's about my kids. As I said, it's about my kids' health. It's about their futures. You know, we, as I said, we have a moral obligation to actually ensure that we do what we can to ensure the health and safety of our communities. And I think, as I said, if we sit by and passively just watch this happen without really sort of getting out there and trying to provide the science and evidence, then I think we are failing. Doctors and clinicians, I think, on the hierarchy of who's sort of trusted in the world, I think we rank reasonably high. And I have, you know, when we compare it to the people that we're arguing against, the coal miners and the gas industries, they've all got vested interest. They've all got money invested in this. It's about them. This is not about me. This is about our population. I have no financial vested interest in advocating for the health impacts of climate change. It's my job. And, you know, as I said, I think it's just what we should all be doing. But I think we need to use our role as clinicians and the trust that we have in our communities to really sort of carry that message forward and be really sort of, as I said, be very, become activists in climate change and health.
Yeah, and we've certainly seen the role that doctors play for a long time in, climate advocacy in Australia. But most recently, I think that light bulb moment of the connection between climate and health with bushfire smoke, for instance, was one of the biggest impacts that we saw for anyone who was kind of, not seeing that that issue in the forefront of their mind, or who had been seeing it as a science or environment only issue. We've got a lot of questions and comments coming in. Jenny saying we need to get all our politicians to support Zali Steggall's bill or come up with an equivalent one. We have to get the federal government to adopt a net zero emissions by 2050 or even earlier. Zali's bill calls for a 2050 target. Island, who I have to admit I got your name wrong earlier, sorry, joining us from Yuggeraland, asks, how have you tackled the fact that a lot of health orgs believe that climate change is not their core business? Furthermore, from a government perspective, since a lot of executives are awarded on short-term incentives, e.g. quarterly or annual results, how do we encourage them to get on board? Big question. Anyone want to go first?
I'll have a go with the health organisations. I mean, it's absolutely true that climate change is not necessarily the top priority for all health organisations, but it is becoming so because it's definitely being woven into kind of strategic plans and is considered a critical issue for many health and medical organisations. It certainly wasn't when we began about 10 years ago, but over that time we've seen an incredible increase in the recognition of the problem by health and medical organisations, and more recently still in their willingness to step up and play a role. However, the delivery of healthcare and the essential purpose of supporting and guiding and educating health professional organisations and ensuring the quality and safety of care is always going to remain a core agenda for health and medical organisations. So we need to understand that. And, I get lots of kind of requests from people outside the health sector to say, why can't we get more doctors and nurses to be stepping up and talking about climate change? And I say, well, a lot of, mostly they're very busy doing their jobs. And, it's hard to find the time to spend on climate advocacy, other than, for individuals like Kate who've sort of carved out a niche and doing that. We need to support them to have those conversations. We're running a project at the moment at Climate and Health Alliance called Real, Urgent and Now, communicating the health impacts of climate change and talking to our health organisations, the leaders and their members. So we're doing a national survey of the members of several health organisations to understand what are the barriers to them communicating about this issue and how can we help. Because it's not the case that many of them received education about this during their training, or that they, have had the time to really embed themselves into understanding how to, be an effective advocate. So there's lots of support required, but I think in their defence, there's a lot of work and a lot of leadership that's beginning to emerge. I'll leave the question about, policymakers and bureaucrats if we've got more time and let someone else respond to.
I think there's a few other opportunities, I think, just off the top of my head. Obviously, the hospital system needs to be green. There's an opportunities there because clearly we've seen leadership from our states around zero targets for 2050, despite the federal government being a laggard in that space, but certainly there's a desire from state governments, and I think greening our hospitals is a great initiative, and I think there's a great opportunity there. But I also think there's a bit of a generational change as well, and I think supporting our new leaders, certainly the language and coming through with our younger clinicians and nurses about sustainability, about resource stewardship. It's just part of what they do and part of their everyday thinking. And I think more and more we need to encourage them to step up and be the new leaders. And I think if there's, I think that's going to be, over the next 5 to 10 years, we'll see a much greater push. As we said, the impacts of climate and health are being built into our education systems. They're being built into our conferences. They're being built into our advocacy. So all of our new generation of doctors and nurses are coming through in that environment, and I think they will carry that forward.
Yeah, and I think unfortunately we've only got 10 minutes left, and there's so many things we can expand on and talk about, but one of the major questions that we want to ask, thinking about the wider context of Better Futures Australia and what is trying to be achieved, is about how the health sector can collaborate. So what is a better, healthier, zero emissions future? What does that look like to you? And how can the health sector actually collaborate in the lead up to COP26 to get us there? Big question. Do you want to go first, Kate? With that side?
That is a very big question. But I suppose the fundamental thing is to talk to each other and collaborate. And I think DEA, I think, is a very good group for that, because we've, and Climate and Health Alliance, because we're, looking at we have members from lots of different colleges and things. It's wonderful to see the AMA being on board with this, and just fundamentally collaborating with each other and owning it as a health problem, so that when our government goes to COP at the end of next year, this resounding health voice is saying, you need to act on this, otherwise you're doing us a disservice and you're acting in an immoral and an unethical manner. That's the first start. I'll let someone else pick it up.
You go, Simon.
You'll be much more insightful than me. You go first.
Well, I guess one of the things that I'll say is that, one of the reasons that our three organisations, Doctors for the Environment, Australasian College of Emergency Medicine and Climate and Health Alliance are on this event today is because we've been working together in a working group to discuss exactly that question. How do we engage with and mobilise the rest of the health sector in the context of this initiative, but around climate change and health more broadly? Well, fortunately, for our three organisations, that is the work that we're doing anyway. And so the Better Futures Australia initiative provides a great kind of moment and a pathway to get people involved. So we'll be working together to engage other organisations in this initiative, encouraging them to showcase their efforts through the Climate Champions initiative of part of Better Futures Australia, so that they can show, like Simon's college, say, as a college, this is the leadership that we've shown, to share with, other sectors and the wider public generally, so that people understand that there is actually a lot going on, and that there's a lot of leadership being shown, and there's a lot of hope and opportunity as well. We'll be organising events to bring people together to really nut out, how we can showcase that in the context of the Better Futures Forum in July next year. We'll have the opportunity to do that with people in our region, because the World Health Organization are organising regional meetings on health and climate change. So, that will be an opportunity to engage people further still. With our advocacy agenda, we'll be, going to parliamentarians and saying, the health sector wants action on climate change, and these are the kinds of directions that we want. We want to see commitments not just to net zero by 2050. I mean, we're actually seeing leadership from the health sector internationally, with the National Health Service in the UK making a commitment to net zero by 2040. So the health sector is actually getting much more ambitious and really calling for, dramatic and urgent emissions reduction. So I think that there's a lot that we can help to bring forward in that context. And as Simon said, where we are trusted voices, we need to use that position to engage people, decision makers and the public.
And I think there's some messages that we can get across the health sector. And I think any clinician understands two fundamental principles of what we do. One is prevention is better than cure, and the other is first do no harm. And I think, when it comes to climate change and health prevention, stopping the progression of climate change, the impact that is going to have, needs to be a fundamental principle. And I think that is something that can link all healthcare professionals together in a very common message. And of course, first do no harm. We should be preventing harm happening. I think we can strongly deliver those sorts of messages to try and unite all healthcare professionals. I think, we can be a very, very powerful voice, or an increasingly powerful voice in advocacy.
And on that theme of how embedded it is in the fundamentals, Kimberly offers the suggestion that health effects of climate change need to be more embedded in the medical school curriculum. I'm seeing a lot of nods there. I'm sure I'm talking to a group of people who think that kind of goes without saying, I'm sure. Also, I just want to remind everyone, we've got Lisa reminding me here in the chat. Simon shared some great examples of climate action that will help others to learn lessons and become fast followers. There's actually actions that you can take by going to the Better Futures website as well. But Lisa asked, do you have stories to share and inspire too? And if so, she says, Better Futures Australia would love to share them. There's www.betterfutures.org.au/share_your_story. So if you go to share your story on the betterfutures.org.au website, then I'm sure there'd be lots of medical professionals who would have stories to share.
Yeah. Was that a question or a comment?
Sorry, there was a lot in there. She said, do you have stories to share? And then there was a call to action, which I just cracked on with.
Yeah, well, I might just jump in and say there's also lots of amazing stories to share in terms of what the health sector is doing in their institutions to reduce carbon and to implement sustainability. So we coordinate as Climate and Health Alliance the Australian and Pacific region of what's called the Global Green and Healthy Hospitals Network. And it's an incredible program that is, generating relentlessly positive stories. It's actually a fantastic program to work on because there's just always good news coming out of it. We had 5 organisations from our region win Healthcare Climate Challenge awards in a global series of awards just this week for the leadership that they are showing on reducing emissions. And that ranges from, supporting environmental justice initiatives and just transition programs for in the Hunter Valley for healthcare for workers there in coal mines to make sure that they're part of the new economy and are supported to do that, to Ambulance Victoria, that's reducing emissions by installing solar across its many different buildings, to really significant emissions reductions in some of our hospitals and healthcare services in New Zealand, setting their own emissions reduction targets and then achieving them. So, hopefully through this initiative, we can help to surface some of those stories as part of the Better Futures Australia initiative too.
Yeah, and having those stories of maybe the more practical institute or business or individual based actions, but in the context of the personal motivations around health and things like that. It goes hand in hand. Ruby also said, excellent discussions about emerging leaders due to generational changes and also due to the multiple initiatives arising and converging to drive the message home to key decision makers. At the heart of inaction has been all along vested interest. Health implications are vast and deep, and they're occurring everywhere. Great job, and thank you for this forum. Thank you, Ruby, and thanks to everyone else who's been joining us on Facebook Live, on YouTube Live, and here on Climate Australia on CimpaticoTV. I just want to just end with some calls to action, and we're going to wrap up a little bit here because there's a lot you can do after this. Anyone who's watching can go to www.betterfutures.org.au. Also go to that website /take_action. So In doing so, you'll be able to see a few different ways you can take action: signing the declaration, sharing a story, as we've just mentioned, attending an event like this one, and you'll be able to help Better Futures Australia to demonstrate the readiness of Australians to collectively step up their ambition on climate change and to ensure that our government delivers the response we need at COP26, which is in November 2021, which sounds far away, but it's actually so soon in another way, thinking how quickly this year went. You can sign the BFA declaration, share your climate champion story, which is to inspire all Australians to see themselves as part of the solution and go further together, because this isn't just about individuals, but those individuals actually working collectively. Also, you can join the sector working group for those who are looking to do more and feed into the big Better Futures Forum in July and in COP26. Thank you so much to the three of you for joining me here today. Thank you to Better Futures Australia for organising this and bringing all these awesome people to my humble little Climate Australia channel. It's been such a delight to host you on the channel. I'm live streaming pretty much every week, although I might take a few weeks off over Christmas and New Year, but I look forward to following the progress of what you're all doing. Thank you so much.
Oh, thank you, Lee. It's been an
Thanks,
absolute
everyone.
pleasure.
Thanks, Lee. See you later.
Thanks.
Bye-bye.
So that's it from us, and I'll just be saying goodbye to each of our speakers there. But remember that you will be able to watch this back, and you'll be able to get a look at all of those different links and all of those calls to action. It's really important to get you all involved. That's it from me. If you've enjoyed this and want to see more, please stick around. You can go over to my Facebook page. If you're watching on Better Futures Australia, we'll be stopping the stream there soon. And you can also go to my YouTube page and of course watch within CimpaticoTV for those of you who are already watching, because next up I will be talking to Jared Delaney. He's a Quandamooka man with a lot of expertise in engaging community in First Nations people, climate justice, decolonisation, and what that means for climate action in Australia, and what even is Australia. So that's what's happening next on Climate Australia channel. But for now, this is me wrapping up the Better Futures Australia panel. Better, healthier futures. Thanks again and goodbye.